Okay. Hi, my name is Chris Weiss. I'm the President and CEO of Dynamic Clinical Systems. I'd like to talk to you today about our company, DCS, and our software integrated survey system. We provide web-based solutions to collect, analyze, and manage patient-reported health data. Our goal is to create a seamless engagement experience for patients, collecting data that's used for both care and research, and then playing it back out for a multitude of purposes, including practice management, outcomes and research, public quality reporting, and other topics. It's called Integrated Survey System. We collect patient-reported health history and outcomes for the process of care, research, and reporting. Most of the data we collect with ISS is directly from patients. We can supplement that with clinically reported data for research, registries, and medical record documentation. We were founded in 2004 off of some initial work done by Dartmouth. Dartmouth College is a licensor of the original technology. We still do a lot of R&D with Dartmouth and Dartmouth-Hitchcock, and there's nobody on the staff or appointees to have any personal financial stake in the company. We have customer relationships in academic centers, private practices, government agencies, academies and special societies, and industry. Our self-development since 2001. We've been in live productive use since 2004, initially in spine, and then in other clinical areas, as I'll show later. Today, the database houses nearly 3 million assessments, and we've been recognized by various agencies for both through granting and contracting, as well as awards to our clinical partners. The data has been used in over 70 peer-reviewed publications today. Everything is collected via a web-based tool. It's real-time. We present information immediately to caregivers at the point of care to facilitate decision-making. It helps clinicians tailor the interaction with patients and maximize the time they have together. We have a preference for validated or general use instruments, patient-reported outcomes instruments, but we will create custom surveys in cases where such surveys don't exist already. We are a HIPAA-compliant platform and highly secure hosted environment. Support roughly 20 to 25 clinical areas used in both care and research, ranging from spine and orthopedics, which is our foundation, through oncology, chronic pain, and other clinical areas. The importance of this list is that it can be as long as needed for a particular implementation. The software does not necessarily change from site to site. The content that we portray through the software is what makes it unique to a clinical area. It's relatively straightforward for us to put up new content. Or at home, it's a browser-based application secure with a secure connection back to our software as a service data center. Patients see one screen at a time in large font. They can use any type of keyboard, tablet, iPad. As long as they can launch a browser, they can respond to. You see several examples of input mechanisms here on the screen. At the bottom right is one of our most popular computerized pain drawing. Patients can select the sensation they're feeling and then draw on the body where they're feeling that pain. This is used in spine and oncology today. We also have a hand and wrist version for carpal tunnel. Highly unique is that we are able to feed forward the information we gather from patients to the point of care real time. Here you see an example of a color-coded patient status report. This is a patient who has responded over 4 visits over the course of a year of care. This is actual patient data showing severely to moderately severely depressed patient, a moderate to severely anxious patient, and a patient who is suffering from PTSD all at once. This is a patient who's being seen in the VA. You can see over the course of care that this patient's scores have gotten gradually better, and this is available plotted longitudinally, color-coded, scored, and normed real-time at the point of care. Out of the software, it's quite common for us to also produce a complete data set that we feed out to our customers through a secure network so customers can integrate the data with SaaS databases, data warehouses, and other means that they use locally to analyze and report on the data. We have a unique offering in the industry. Alkem Solutions are the primary focus of our business. We have demonstrated over time that the web-based system is easy to use with a proven user interface. Patients can interject data directly and from home as needed, and actually to provide it from home. We can send automated email reminders to patients to improve compliance. We provide real-time graphical results right to the point of care to aid decision-making. And we have a variety of mechanisms to track and help patients comply with need to provide data. A couple of last points. We also do have a robust research support services offering for sites who need help designing studies, analyzing data, writing reports, and writing proposals. And it is a software as a service model. The price we charge is inclusive of all support, maintenance, releases, updates, and hosting, including backups, bandwidth, and a certified data center with 7x24 support. Thank you for your attention.